Hi, I'm Demi. In my last video, I talked about the main symptoms of Alzheimer's disease at different stages. In this video, I'll discuss what to do if a family member is experiencing memory loss or dementia. The following questions may be what we are most concerned about. How is Alzheimer's disease diagnosed? How many times do we need to visit the doctor, and how long will it take to get an accurate diagnosis? What tests will the doctors use to diagnose Alzheimer's disease? Can we assess Alzheimer's disease by ourselves? Can we afford the diagnosis? Here, I'm happy to answer these questions for you one by one. To explain how Alzheimer's disease is diagnosed, I'll refer to the novel Still Alice again. Let's see what Alice did after noticing her memory loss. First, Alice visited a neurologist who conducted a thorough neurological examination to assess her memory, problem-solving skills, language abilities, and other cognitive functions. During the tests, Alice struggled with numerous tasks. For example, she had difficulty recalling a list of words that had been read to her just minutes earlier and struggled to draw a clock face correctly. The tests confirmed that Alice had memory loss and cognitive difficulties that were beyond what could be attributed to normal aging. Consequently, Alice underwent a magnetic resonance imaging scan, which revealed atrophy, or shrinkage, in her brain, particularly in the hippocampus. Based on the MRI findings and her cognitive test results, Alice was diagnosed with early-onset Alzheimer's disease. Since Alzheimer's is closely associated with genetic mutations, Alice then took a genetic test. The results showed that her PSEN1 gene had undergone mutation. Alice's elder daughter, Anna, also underwent genetic testing, which indicated that she carries the same gene mutation as her mother. The novel Still Alice was published in 2007. Over the next 17 years, the methods for diagnosing Alzheimer's disease in hospitals have remained largely the same, although significant progress has been made in brain imaging and in detecting cerebrospinal fluid or blood biomarkers. The initial step, cognitive assessment, has remained 90% the same. Then how many times do we need to visit the doctor, and how long will it take to get an accurate diagnosis? There is a specific criterion used to diagnose Alzheimer's disease in clinical trials and research, known as the NINCS-ADRDA criteria. To meet this criterion, numerous data points, including the patient's medical history, clinical interview, neuropsychological testing, and laboratory assessments, will be collected. Therefore, you might expect to visit the doctor multiple times over several months before receiving a conclusive diagnosis. Then, what tests will the doctor give to us to diagnose Alzheimer's disease? Can we assess it by ourselves? In the short term, the doctor will collect your medical history, perform clinical interviews, conduct neuropsychological testing, and carry out laboratory assessments. Medical terms like clinical, neuropsychological, and laboratory might seem vague or confusing, but don't worry, I will explain each in a little more detail. If you are a science enthusiast, you can try all the tests yourself, except for the laboratory part. Medical history. As with all diseases, the physician will review your medical and family history before proceeding with a deeper diagnosis. Pay attention to diseases such as cardiovascular conditions, diabetes, obesity, depression, traumatic brain injury, hearing loss, and chronic inflammatory diseases, as they are closely associated with Alzheimer's disease. If you are experiencing memory loss or cognitive difficulties, the physician will also record the onset, progression, and characteristics of these cognitive symptoms. A clinical interview may include several examinations and assessments and is used to evaluate the patient's cognitive and behavioral symptoms. 1. Mental status examination. 2. Behavioral and psychiatric assessment. 3. Motor and sensory examination. 4. Assessment of daily living activities. And 5. Assessment of insight and judgment. Again, please don't be intimidated by the medical terminology. I'll simplify these terms for you. 1. Mental status examination. A. Orientation, awareness. The patient may be asked about what day it is, what time it is, where they live, what their name is, and what their spouse's name is, among other questions. B. attention and concentration. The patient may be asked to perform serial subtraction or repeat sequences of numbers to evaluate their ability to focus and maintain attention. C. Memory. The patient may be asked to recall a list of words after a short delay or provide information about past events to examine both recent and remote memory. D. Language. The patient may be asked to name objects, repeat phrases, follow commands, and give spontaneous speech to assess their language ability. E. Executive function. The patient may be asked to perform simple calculations or plan a multi-step activity to evaluate their abilities in planning, problem-solving, and abstract thinking. 2. Behavioral and psychiatric assessment. A. Mood and effect. The physician will ask the patient some questions and observe signs of depression, anxiety, or other mood disorders in response to those questions. B. Behavioral changes. The physician will observe any changes in behavior or personality, such as agitation, apathy, or inappropriate behavior. 3. Motor and sensory examination. A. Motor function. The physician may observe the patient buttoning a shirt to evaluate motor skills and coordination. B. Sensory function. The patient may be examined for changes in sight and hearing and may be asked to replicate gestures made by the physician. 4. Assessment of daily living activities. The patient's ability to perform activities of daily living, such as dressing, grooming, and managing finances, will be evaluated to measure the level of functional impairment. 5. Assessment of insight and judgment. The patient may be asked to respond to a hypothetical situation, such as what they would do if they found an ID card on the sidewalk, to determine if the patient is aware of their cognitive deficits and if they have the ability to make sound decisions. 3. Neuropsychological testing. Based on the results of the medical history and clinical interview, a neuropsychologist will determine whether the patient meets the criteria for dementia and how likely it is that the patient has Alzheimer's dementia. The physician will then decide whether to proceed with neuropsychological testing, which tests to administer, and how to administer them. A technician, usually a psychometrist, will perform the tests on the patient. The criteria for dementia and probable or possible Alzheimer's disease are quite complex. However, you can at least assess whether the patient meet the criteria for all-cause dementia. The symptoms of all-cause dementia should involve at least 2 of the following domains. A. Impaired ability to acquire and remember new information. Symptoms include repetitive questions or conversations, misplacing personal belongings, forgetting events or appointments, and getting lost on a familiar route. B. Impaired reasoning and handling of complex tasks, poor judgment. Symptoms include poor understanding of safety risks, inability to manage finances, poor decision-making ability, and inability to plan complex or sequential activities. C. Impaired visuospatial abilities. Symptoms include an inability to recognize faces or common objects, difficulty finding objects in direct view despite good acuity, and trouble operating simple tools or orienting clothing to the body. D. Impaired language functions, speaking, reading, writing. Symptoms include difficulty thinking of common words while speaking, hesitations, and errors in speech, spelling, and writing. E. Changes in personality, behavior, or comportment. Symptoms include uncharacteristic mood fluctuations such as agitation, impaired motivation, apathy, loss of drive, social withdrawal, decreased interest in previous activities, loss of empathy, compulsive or obsessive behaviors, and socially unacceptable behaviors. If the patient meet the criteria for all-cause dementia, it is worth proceeding with neuropsychological tests. You can find many free online tests if you want to try them yourself, and there are numerous YouTube videos that explain how to perform these tests. The following are brief introductions and some online sources for the most common tests. Mini Mental State Examination, MMSE. The MMSE is a 10 to 15-minute test that measures various cognitive factors, including memory, orientation, attention, and language skills. A score below 24 out of May 30th indicate dementia. Montreal Cognitive Assessment, MoCA. The MoCA is a brief test that can help determine if there are deficiencies in multiple cognitive domains. Tasks include memorizing words, naming objects in pictures, and copying shapes. The MoCA is available in many languages and versions for people with hearing or visual impairments. A score of 26 or higher on the MoCA is considered normal. Mini-Cog. The Mini-Cog is a test that includes memorizing and recalling a list of words and drawing a clock to show a specific time. The interpretation of the score can be a bit confusing, but a score of 3 is generally considered normal. In addition to the above tests, other cognitive tests such as ACE3 and SAGE are also available, and you may be able to obtain paper or online versions through various suppliers. However, regardless of the scores you get from these cognitive tests, it is advisable to see a doctor for further evaluation. If the doctor has significant concerns about your cognitive test results, you may be required to undergo additional laboratory examinations to obtain a more accurate and specific diagnosis. 4. Laboratory assessments. The most common laboratory assessments include MRI or CT scans. Additionally, PET scans, blood tests, and cerebrospinal fluid analysis help increase the accuracy and specificity of the diagnosis. 1. MRI. MRI is currently one of the key medical examination techniques used in hospitals for diagnosing Alzheimer's disease, AD. Typical changes in brain structure associated with AD include A. Atrophy. MRI scans can reveal areas of the brain that have shrunk or atrophied. This often includes the hippocampus, one of the first brain regions affected by AD. The degree of atrophy in the hippocampus can serve as a diagnostic marker for AD at the mild cognitive impairment (MCI) stage. B. Widened sulci. The folds in the brain may become narrower, and the gaps between them may widen. C. Dilated lateral ventricles. The lateral ventricles may become more dilated. Super confusing about the medical terminology? Just image the normal brain is a perfect walnut and the Alzheimer's brain is a dry shrunken walnut. 2. Positron emission tomography, PET scans. PET scans are not always the first-line diagnostic tool due to their cost and limited availability. They are typically used when the diagnosis is unclear or when additional information is needed. PET scans are frequently used in research and clinical trials. If patients are particularly interested in a PET scan, they may still have the opportunity. Let me simplify the PET scan first. It is like using high-powered magnifying glass to spot dust on the plant leaves. In a brain, the brain cells are leaves and bad proteins like amyloid are the dust. Several types of PET scans can be used for Alzheimer's patients, including amyloid PET, tau PET, FDG PET, and TSPO PET. Among them, the most commonly used one is amyloid PET, which measures abnormal deposits of beta-amyloid protein in the brain, a hallmark of Alzheimer's disease. This scan can help distinguish Alzheimer's from other causes of dementia or memory loss and is appropriate for patients with mild cognitive impairment, progressive dementia, or early onset. 3. CSF analysis of biomarkers. Cerebrospinal fluid analysis is less commonly used as a first-line diagnostic tool due to its invasive nature. Lumbar puncture can be intimidating, and the availability of other non-invasive options like imaging and cognitive testing. However, CSF analysis is increasingly used in diagnosing the early stages of Alzheimer's disease or when imaging scans are inconclusive. For this analysis, a CSF sample is collected from the lower back using a special needle. The sample is then analyzed for A-beta-42, p-tau, and total tau proteins. This procedure requires a local anesthetic, carries some mild risks, but is less costly than a PET scan and is more accessible to most patients. Again, don't be scared by the name of the biomarkers, just remember they are bad guys, that is enough. 4. Genetic testing. In some cases, if a person shows symptoms at an early age with a strong family history of Alzheimer's, a neurologist or other medical specialist may order genetic tests for AP, PSEN1, and PSEN2 because their mutations are causing brain traffic jams. Although APO testing is also available, the results cannot fully predict who will or will not develop Alzheimer's. 5. AI methods. In addition to imaging scans, CSF analysis, and genetic testing, artificial intelligence methods have proven promising in diagnosing Alzheimer's disease earlier and more accurately, although most are still experimental. Just as pathological AI tools may surpass the performance of human pathologists, AI methods might also outperform human doctors in diagnosing Alzheimer's. AI tools have more powerful computational capacities, enabling them to process data integrated from multiple sources faster, and to identify patterns associated with Alzheimer's disease more efficiently and with less bias. BrainSee is the first AI tool approved by the FDA, based on neuroimaging, for predicting the likelihood that a person with mild cognitive impairment will progress to Alzheimer's disease-associated dementia. Then, how accurate is the diagnosis of Alzheimer's disease? The NICT's ADRDA criteria was established in 1984 and is still used today with some updates. In 2011, their sensitivity was around 81% and specificity around 70%. In 2024, by combining all current diagnostic methods, including advanced PET scans, CSF biomarkers, genetic testing, and clinical evaluation, the accuracy is approximately 85 to 95%, with specificity around 85 to 90%. So, it is pretty good. Well, now it is time to talk about the cost. What are the typical prices for diagnosing Alzheimer's disease? An online neuropsychological test like the MMSE may be free or cost between $25 to $75. If you seek an accurate diagnosis of Alzheimer's disease, a general visit to a neuropsychologist may cost between $150 to $300 per hour. This table displays the typical prices for various diagnostic methods. These prices can vary significantly between cities, and there is a considerable difference in cost depending on whether or not insurance is used. In addition to these imaging and laboratory methods, scientists are working hard to develop more convenient and accurate diagnostic methods, such as using novel blood or saliva biomarkers. The ideal method should allow for easy sample collection and provide fast results, making it feasible to screen large populations. The cornerstone of Alzheimer's diagnosis should be early detection and prevention, as once the disease has begun, all doctors can do is slow its progression. There is no way to reverse it. I'm going to end this video now. In my next talk, I will focus on the treatment of Alzheimer's disease. See you soon.